Привет, дорогие друзья! I am Dr. Julius Kwedhi, MD, and I'm back again with another video on topographic anatomy. And today we are continuing with fascias and cellular spaces. Now, make sure to like, subscribe, and share the video with your friends. All right. Now, let's look at this one aspect, very important aspect of topographic anatomy. When we study topographic anatomy, one of the very important ways we study topographic anatomy is by examining transverse sections. Transverse sections have been very helpful even in the days of Pirogov, Nikolai Ivanovich Pirogov, the one who studied the field of topographic anatomy. He would often study the transverse sections of limbs and other parts of the body in order to understand their topography. All right. Why? Because when you have a transverse section, then you have the preserved integrity of muscles, vessels, nerves, Fascia Laminae, the lamina of the fascia of the fascias, and so for somebody like for example, a surgeon who carries out amputations, it's very important to understand the transverse sections, because then that will allow the surgeon to identify the vessels and the neurovascular bundles that may need to be sutured or treated before removing the tourniquet, right? Okay, so one way in this day and age that we study cross-sections is by radiological cross-sections, the radiological imaging, right, especially by the CT X-ray and magnetic resonance tomography, as well as magnetic resonance imaging, pretty much the same thing, right? MRI, MRT, and the advantage of the radiological cross-sections in this day and age is that they allow the doctors, they allow the surgeons to be able to study any part of the body non-invasively. So you are able to see the deeper aspects of the body without actually having to cut open the patient. How cool is that? Now, other methods that allow us to study topographic anatomy or anatomical structures are contrast, which is injected into the blood vessels, into the veins, histotopography, angiography, as well as computer tomography. Now, let us quickly turn to fascia and cellular spaces. Now, fasciology was first introduced by Nikolai Ivanovich Pirogov, who was a war surgeon in Russia in the 1800s. I.P. Machushenkov, who was a professor of topographic anatomy and operative surgery at Sechenov University, my former university. He greatly expanded the field of topographic anatomy, but other great surgeons also made great contributions, such as V.V. Kovanov, as well as T.I. Anyikina and their colleagues. They performed basic facial topography, which has been very helpful in improving our understanding of topographic anatomy. Machushenkov is said to have said that fasciae are the soft skeleton or the soft framework of the body, whereas you have the bones that are the firm base. The fascias are the flexible continuation of this base. That's what he said. No. Now, the fascia is also known as, is by definition a bandage or a dressing or a covering, meaning it is a membrane made up of tight, dense, connective, fibrous tissues that covers muscles, nerves, blood vessels, as well as internal organs, acerous internal organs. Now, fascias, they are made up of collagen and elastic fibers in a particular ratio, depending on the physiology of that, depending on the function of that fascia. Now, the ratio of the collagen to elastic fibers of the fascia is determined by the pressure exerted on that fascia, as well as the function of that fascia. Now, when you talk about the pressure of the exerted on the fascia, that determines the ratio of elastin to collagen, the more the pressure exerted on the organ, then the more collagen fibers you have, and the more collagen fibers you have, then the denser the fascia, and then on the other hand, the less pressure is exerted on that organ, the less the pressure is exerted on that organ, the more the elastic fibers in that organ, and then the more the elastic fibers you have in that organ, the loose the fascia is, right? So dense fascia receive more pressure, or more pressure is exerted on dense fascia than is exerted on the loose fascia. Now, loose fascia is the likes of loose fascia is such as the adipose tissue as well as the cellular tissue. Now, the ratio also depends on function. And what are the different functions of the fascia? Regulate blood flow in the veins, regulate blood flow in the veins, from the limbs to the heart. The trophic function, which is the nutritional function, meaning nutritional function, that is the trophic function, as well as the supportive function, right? So, in other words, fascias, they support, they help, they're involved in the feeding of tissues, and they also help in the blood flow. As we said, fascias, they cover visceral organs, they cover muscles, they cover nerves, they cover other vessels, right? The neurovascular bundles, they cover organs, yeah. And the trophic, with respect to the trophic nutritional function, the fascias, they are involved in the interstitial metabolism, right? So because they cover the adipose tissue, and it is this adipose tissue that is involved in the water and salt exchange between the blood as well as the tissues, between the blood and the interstitium, between the blood and the tissues. Now, the supportive function of the fascia, as we said, they cover organs, they cover different structures, and when you have a more dense fascia, which have a lot more collagen compared to elastin, such as the ligament, the tendon, and the cellular tissue, those are the ones that support. They support different parts of the body, right? The fascias are also involved in feeling the interstices. Again here, when the fascias, as we'll see later on we'll see the feeling aspect of the interstices. But now let us just say that the cellular adipose tissue, which is usually found between the fascias, feels the interstices of muscles, of vessels, of nerves, and then this cellular adipose tissue that fills the interstices is usually covered by the lamina facialis. Now, what is lamina facialis? We'll look at that. Yeah, what is the lamina of the fascia? We will look at that. Now, an example of dense fascia, as I said, is ligaments, tendons, cellular tissues, and aponeurosis. Now, look at this. Fascias have different levels of thickness and firmness. For example, when you look at the aponeurosis, which is a dense fascia supported by tendinous fibers, the aponeurosis takes on different forms, right? Different thickness. For example, on the lateral aspects of the thigh, laterally, the aponeurosis is known as fascia lata on the lateral aspect. However, when you go on the upper third, when you move to the upper third of the anterior surface of the thigh, then that fascia becomes loose lamina fibrosa. In other words, the loose perforated lamina. Now, about the fascias, we have two different types of fascias, right? As we said in our previous videos, you have the skin, and then you have the adipose tissue, and then you have the superficial fascia, and then after that you have the proper fascia, and then after that you have after the proper fascia you have the deeper structures, the deep subfacial structures, right? Now, this is your proper fascia, and then you have the deep subfacial structures, all right? Now, let us first look at the superficial fascia, Fascia superficialis. So Fascia superficialis is a loose, fragile lamina. It's loose, fragile lamina, and it comes directly after the subcutaneous tissue. And this fascia covers the entire body. The superficial fascia covers the entire body totally. All right. Now, what else? The fascia superficialis, it serves as the attachment of subcutaneous structures. Right? As we said, that you have the skin, and then you have the adipose tissue, right? The subcutaneous tissue, subcutaneous fat, right? And then you have your superficial fascia. So, and then you have here the artery, and then you have the vein, and then you have the nerves, right? So you have the neurovascular bundle. Now, so these are usually attached, right? The attachment of subcutaneous structures. So these structures, they usually have an attachment on the fascia superficialis, right? The subcutaneous adipose tissue, the nerves, the vessels, veins and arteries, they are connected to the fascia superficialis. Now, fascia superficialis also serves as a capsule. Serves as a capsule for muscles, for example, the mimic muscles of the face. Yeah, for example, the mimic muscles of the face. It also serves as a capsule for example, the muscles of the neck, like the platysma. Like the platysma, if you know, the platysma is a thin sheet of muscle. And then you also have the superficial fascialis forming as a capsule for the breasts, for the mammillary glands. That's a capsule for the breasts. Okay, what else? The fascia superficialis, it fuses with the deeper lying aponeurosis. Also, so the superficial fascia, the fascia superficialis, it fuses with deeper lying aponeurosis, meaning in that place, in certain places, the superficialis fascia superficialis, in certain places of the body, in certain regions of the body, fascia superficialis fuses with deeper lying aponeurosis, and therefore, in those places, you will not find superficial fascia. For example, the palm of the hands, the palm of the hands, the soles of the feet, as well as on the calvaria, the skull. Well, the scalp, the scalp. No, the calvaria. Now, and in those places where the fascia superficialis is fused with deeper lying aponeurosis, like the scalp, then, as we said, you have your skin. If you look at the schematic diagram, you have your skin, you have the connective tissue, connective bridles here, right? We'll look at these connective bridles. So you have the skin here, then you have your subcutaneous tissue that is cellular in those places, like the scalp, as well as the sole of the hand and the palm of the hands and the sole of the feet. So you have your skin, and then followed by the subcutaneous tissue, and then beneath the subcutaneous tissue you have the aponeurosis. But then between the aponeurosis and the subcutaneous tissue, instead of instead of this being a superficial fascia, you have the aponeurosis that comes directly beneath the subcutaneous tissue, and then you have these connective bridles, right? These anchoring points that connect the subcutaneous tissue to the aponeurosis. Now look at this. They are vertical. They are vertically oriented, right? That means if there is damage to the blood vessels, for example, to the arteries in that part of the body, if there is a damage and then there is a hematoma that is formed there, then what happens is instead of this hematoma spreading horizontally, right, horizontally to the left and to the right, it rather spreads from this upper aspect, from the superficial aspect to the deeper aspect. All right. Now that is the danger. For example, you can also have suppurative processes, inflammatory processes. Once they happen here, then they begin to flow downward to go deeper. They begin to go deeper instead of going horizontally. All right. So pay attention to that. Now, let us go to the Fascia Superficialis, right? Let us turn to the superficial fascia. All right. Now, not Fascia Superficialis, but Fascia proper. Let us turn to the Fascia proper. We have just discussed the Fascia Superficialis. Now we are moving to the Fascia proper. Now, the Fascia proper, the proper fascia, like the superficial fascia, the Fascia proper also covers the whole body. It also covers the entire body. Now look at this. The superficial fascia, as we said before, you have the skin first, followed by the subcutaneous tissue, right? And then that's followed by the superficial fascia right there. Now, then you have the neurovascular bundles within the subcutaneous tissue. And then after that, after the superficial fascia, then you have the proper fascia. You see that? So the proper fascia comes beneath the superficial fascia. Now look at this. All the structures that are between the skin and the fascia proper, all the structures that are between the two, those structures are called superficial structures. They are called superficial structures. But all the structures that are beneath, all the anatomical structures beneath the fascia proper, meaning as you go deeper, they are also known as deep subfacial structures. They are also known as deep structures, right? Deep structures like the deep subfacial structures. For example, visceral organs, the heart, the kidneys, the arteries, like the abdomen, they are like the abdominal aorta. Then you also have the omentum, is another deep subfacial structure, right? The omentum major and omentum minor, as you may know, right? And then you have the abdominal fat. Then you have your skeletal muscles. Now, the fascia proper, the name of the fascia proper in different regions of the body are determined by the region of the body, right? For example, when you're in the abdominal cavity, the fascia proper there takes on a different name. For example, it becomes the abdominal fascia. When you're in the chest, in the pectoral cavity, in the thoracic cavity, then there you have fascia pectoralis, right? It becomes fascia pectoralis. But then when you go to the arms, for example, the arm, and you find the fascia proper there, you find it takes on a name, for example, the fascia antebrachiae. So it is the superficial fascia. The name of the superficial fascia remains the same throughout, but it is the fascia proper that changes. The name of the fascia proper changes depending on the part of the body where it is located. Now, in certain places in the body, the fascia proper splits, and then when it splits, it gives off, you could say, two daughter fasciae. So it splits into two, and those two portions of the fascia proper that are split, they are not fascia, but they are lamina. So they are lamina. For example, in the neck, right? For example, in the neck, the fascia keeps dividing to cover different muscles, and so it always divides into two different laminae. You would have the superficial lamina, which is more closer to the skin, and the deep lamina, which is deeper. Right? The lamina closer to the skin is called the superficial lamina, and the lamina that is deeper is known as the deep lamina. Now look at this. The superficial lamina is also known as, for example, in the neck, you'll find the lamina of the neck. For example, you find, they say, lamina superficialis of the fascia proper. Right? So this lamina takes on the name of its mother lamina. So you would have, so that lamina is called the superficial lamina of the fascia proper. And then the deep lamina is known as the lamina profunda of the fascia proper. All right. We'll focus on that as we go along. Now, look at this. Okay, again, reminding us of our diagram, you have your skin, then you have the subcutaneous tissue, and then after that you have the superficial fascia, and then after that you have the proper fascia proper, and then after that you have the deep subfacial structures, deep subfacial structures. Now look at this. And we said the proper fascia divides into the superficial fascial lamina and the deeper lamina, right? Deep lamina. Now, in certain places, like where the superficial fascia and the deeper lamina and where the proper fascia divides, it normally covers muscles like the deltoid, the gluteus maximus, and the parotid gland, but it also covers neurovascular bundles, right? The lamina also cover neurovascular bundles. Now, in those places where the lamina proper, the fascia proper, in those places where the fascia proper divides into the superficial lamina and the deep lamina, you would have septa. A septum is a division. A septa that runs from the superficial fascia all the way to that are marked in yellow here, that are running deep, right? Deep from the superficial fascia, deep to the deep lamina, from the superficial lamina to the deep lamina, from the superficial lamina to the deep lamina. So those are septa, septum. Now, for example, let us look at the diagrammatic representation of this gentleman's gastrocnemius, right? Muscles here, the muscles of the legs here. Now, on the right here, we have, for example, you can see here, you have the bone here, you have the bone here, and then you have your neurovascular bundles here, right? Marked by V and A. You have your artery and your vein here. And then once again, you have the skin, right? You have your skin here. And then after that, you have the subcutaneous tissue, followed by the subcutaneous tissue. And then that is followed by the superficial fascia, right? And then, look at that. After that, it's followed by the proper fascia, right? Now, then I said, the proper fascia can divide like for example you see here, it divides into the superficial and the deep laminae, right? Divides into superficial and deep laminae, and therefore it forms a what? A capsule around the muscle, right? Like here you have these muscles here, we have this muscle here, and then the fascia forms a capsule around the muscle, right? Forms a capsule around the muscle. Now, look at this. When the proper fascia divides and forms the superficial lamina and the deep lamina, and then it covers different aspects of the muscles and divides muscles. It eventually divides the muscles into compartments. Divides muscles into compartments. So it is the laminae of the proper fascia that divide the muscles into compartment, right? And then those compartments are known as facial compartments. Those compartments are known as the facial compartments. Now, let us look at this. The facial compartments, they're made up of the fascial laminae. Now, those fascial laminae are immediately, as we said, they are connected by the septum, the fascial laminae, the superficial fascial lamina, right, and the deep fascial lamina are connected by the septum. They are connected by the septum. Now, within that that compartment, you would have after the superficial fascia lamina, after the lamina of the superficial fascia, right? Now look at this. The proper fascia divides into the deep and superficial lamina. Now these laminas are followed by another covering. For example, the covering of the muscles, right? The epimysium, for example. So you have another fascia, another small connective tissue, another loose connective tissue that is covering the another tissue, another fascia, so to say, that covers the muscle. Now look at this. Theoretically, potentially, when those laminas divide and encircle a muscle, they form a space. There is a space in the middle, right? Theoretically, there is a space in the middle, and practically, there's a space in the middle. That space is called a cellular space. That space is called a cellular space. And that cellular space is filled with the interfacial cellular tissue. The interfacial cellular tissue, they fill the space between the laminae. So the interfacial cellular tissues, also known as the cellular interstices. So this interfacial cellular tissue is, for example, the loose connective tissue, the fat. Yeah, the fat. You'll find fat, a fat pad, so to say, that is surrounding, that follows the lamina and is padding, so to say, the neurovascular bundles as well as the muscles. All right. I hope that is clear. Now, in places like the neck, for example, where the lamina, the proper fascia, where the proper fascia divides into the deep and superficial lamina, in those places, as we said, the laminas can cover muscles, the laminas can cover the neurovascular bundles. For example, in the neck, you'll have the carotid artery. You have the carotid artery here. You also have the interior jugular vein, and then you also have the vagus nerve, right? So that is your neurovascular bundle, and you have the neurovascular bundle on the left as well as on the right. Now, look at this. So there's your capsule there, your your lamina of the proper fascia. Now, the lamina of the proper fascia that surrounds the carotid artery, the internal jugular vein, and the vagus nerve, it is called the carotid sheath. So, the lamina of the proper fascia, they form a capsule. So, that capsule is known as the facial sheath. So, it's also known as a sheath or as a capsule. Facial sheath or facial capsule. The lamina of the proper fascia form capsules or sheaths. The lamina of the proper fascia, they surround muscles forming compartments, right? But they also form sheaths around neurovascular bundles, around individual muscles, around muscle groups, and around organs. Now, so those are the two types of compartments. You have the compartment, right? You have a compartment that is made by the Laminae superficialis and Laminae profunda, and then separated by a septum, right? So you have a compartment and another compartment, right? But then in certain places, the lamina surrounds the neurovascular bundle or surrounds a muscle, right? And then immediately beneath that is the subcutaneous tissue, right? Not subcutaneous tissue, but just the interstice, the cellular interstice, not subcutaneous. It's the cellular interstice. And then you have your blood vessels there, and artery, vein, and then you have your neuron there, your nerve there. And so this lamina that now covers this neurovascular bundle is now called a sheath, right? Or capsule, right? Sheath or capsule. That's a second type of compartment, right? So here you don't have septum, you just have the sheaths. Okay. Now, let us move on to the next aspect. Now, as we said, first of all, you have the skin. You have the skin. You have the skin, right? You have the skin, followed by the superficial fascia, followed the subcutaneous tissue, and then superficial fascia. Now, when you get to the proper fascia, when you get to the proper fascia, in some parts, for example, in the thoracic cavity, in the pelvic cavity, as well as the abdominal cavity, the fascia, the fascia proper forms what we call the intercavitary fascia. It forms what we call the intercavitary fascia. The intercavitary fascia. Now look at this. The fascia divides into two, and it forms. So the fascia, for example, when you're in the thoracic cavity, it's called the fascia endothoracica, right? In the thoracic cavity, the proper fascia is called the fascia endothoracica. So we said, depending on the region where you find the fascia proper, depending on the region, it takes on the name of that region. So fascia endothoracica in the thoracic cavity, and then you have fascia abdominalis in the abdominal cavity, and then you have fascia endopelvina in the pelvic cavity. Now, the proper fascia, now, it divides into two laminae. It divides into the parietal laminae, which is superficial, right, relative to the lamina, which is superficial, right, the parietal lamina, and then it also divides into the visceral lamina, right, which is deeper. Now, look at this. The parietal laminae covers the inner wall of the cavity. The parietal laminae covers the inner wall of the thoracic cavity, covers the inner wall. That's why it's called fascia endothoracica, fascia endopelvina, fascia endoabdominalis. So it covers the inside part of the thoracic, pelvic, and abdominal cavity, for example. And so that fascia now, the part of that fascia, because it divides into two, the part of that fascia that covers the wall, the part of that fascia that attaches to the wall is known as the parietal lamina, parietal lamina, parietal lamina. And then the part of that fascia that covers the visceral organs, the organs like the heart, the lungs, is known as the visceral lamina. So you have the parietal lamina that is attached to the thoracic wall or the abdominal wall. Then you have the visceral lamina that is attached to the visceral organs, the heart, the lungs, the trachea, and so forth and so on. Right? Now, between the parietal lamina, and the visceral lamina, you find a space there. That space is called the cellular space. Right? The cellular space is found between the parietal lamina, and it's very important to take notice of this space, because this space is a potential space. It's a potential space. Potential space, meaning it can be filled with substances. All right. What do I mean? For example, when you look at the heart is covered by before that, right? So this space, the cellular space between the parietal and the visceral lamina, is a potential space that can be filled with fluids, right? Can be filled with fluids such as blood. What else? Suppurative processes, suppuration, right? Pus, right? Can also be covered by air, right? Now, air is not a fluid, of course, but you get the point. Now, the visceral lamina, when you talk about the visceral lamina, for example, here you have your heart, right? And then we have your left atrium, left ventricle, right atrium, right? And this is your pulmonary trunk, and this is your aorta, right? Now, look at this. Of course, this is your septum, right? Your division. Now, when you look at the organ like the heart, the visceral lamina that covers the organs, the visceral lamina covering the organs, is not fixed, is not affixed by connective tissues to the wall of the organ. There is a space also. There is a space between the visceral lamina and the wall of the organ. And that space is filled with cellular interstices. It's filled with cellular interstices. For example, the adipose tissue. Now, but it's also filled with, like around the heart, you have a small amount of fluid, right? You have a small amount of fluid. Also, around the lungs, between the visceral and the lung, all right? Actually, between the visceral and the parietal cavities of the lung, visceral and parietal laminas of the thoracic cavity, there is a small amount of fluid. Now, but when you talk about the heart, for example, there is a space between the heart and the visceral lamina, right? And that space is a potential space, and it's a very important space. Why? Because if the heart ruptures, for example, the patient has ischemic heart disease, and then that part of the ischemic heart disease becomes weak to the extent that it ruptures. So once it ruptures, then because of scar formation, right? Then you have the rupture. It becomes so weak and then it ruptures. When it ruptures, or there is a penetrating object, like a knife, for example, right? Like a knife, for example, or in a motor vehicle accident, some sharp objects pierce the heart, then blood can flow out of the heart chambers into that space, forming tamponade around the heart, right? Look at this. Between the parietal and the visceral, between the parietal and the visceral lamina of the fascia proper of the thoracic cavity, there is a potential space. That potential space is filled normally with a small amount of fluids. Now, you need to be very much aware of this space. You need to have a good knowledge of this space. You need to know about this space. Why? Because this space can be potentially filled with air, blood, and pus. And if it's filled with air, of course, you know, now you have pneumothorax, right? Now you have pneumothorax, meaning air in the thoracic cavity. If it's filled with blood, then you end up having hemothorax, which is blood in the thoracic cavity. If it is filled with pus, it is called piothorax, which is pus in the thoracic cavity, right? This is because of infection. Piothorax, yes, infection can end up there, tuberculosis and staphylococcal infection, streptococcal infection, Klebsiella infection, you know. Now, if for example in the neck, right, the trachea is violated somehow, and then the air flows out from the trachea into the connective tissues underneath into the subcutaneous tissues, you can have subcutaneous emphysema. Air can accumulate, can escape from the trachea or from the airways and accumulate under the subcutaneous, in the subcutaneous tissue. There you can have subcutaneous emphysema. In the skull, for example, when there is trauma, blunt trauma or whatever laceration that causes damage to the veins in the, you can have epidural hematoma, right? You can also have subdural hematoma. Here is a quick tip to help you remember epidural and subdural hematomas. Epidural hematomas, they have a dome that looks like a P, isn't it? They have a dome that looks like the upper aspect of the T. That's why it is then epidural. So just by looking at it, and it looks like a small P like that, then you know that this is epidural hematoma. But subdural hematoma, you know, it does not have this hump. It's rather submerged, right? It's rather submerged, like a submarine, submerged under the dura mater. And so it's subdural, right? Under the dura mater. Subdural, submerged, subdural hematoma. Epidural, looks like a P. Subdural is more diffuse, right? And of course, you know, the epidural is because of those septors that divide the different compartments of the epidural space. Now, let us move on to the next aspect. Now, we talked about cellular interstices. We talked about cellular spaces. Now let's look at this. Around the neurovascular bundles, for example, here you have your artery, then you have your vein here, and then you have your nerve, right? This is your neurovascular bundle. In the cellular interstices, the fat pad, the cellular space. This is a cellular space, right? Which is filled with cellular interstices, which is fat. You can have an infection there. You can have an infection in the cellular interstices. This infection can result in pus formation, also known as suppuration, right? And this suppuration can only be treated surgically. But here's why we need to know about these spaces. It's because, for example, when this cellular interstice is infected by whatever bacteria, the infection can cross from one compartment to another compartment. What do I mean? For example, you have your lamina, right? Your superficial lamina of the fascia, and then you have your deep lamina of the fascia, and then you have superficial lamina of the proper fascia. Then you have the deep lamina of the proper fascia. Then you have the septum, right? You have the different septums, right? And then you have the neurovascular bundles that cross from one compartment to another, from one compartment to another compartment to another compartment. Now look at this. If the cellular interstices is infected, this neurovascular bundle is almost like a pipe, and it runs across different compartments. So pus in one compartment can quickly flow down or up or down this pipe of neurovascular bundle, and therefore the neurovascular bundle acts as a good conductor. It acts as a good conductor. Of the suppurative process. So the neurovascular bundle is a pipe that flows with water, begins to flow with pus, and that pus crosses over from one compartment to another compartment. And so that pus can move to the nearest compartment, right? That pus can move to the nearest compartment, or it can even move further to the furthest compartments, right? It can move further to compartments far away. And look at this. The infection may not necessarily, because it does not necessarily remain where it started, you may find that even if the infection may look like it is in one area, it goes down further to other parts of the tube, to other parts of the neurovascular bundle in another compartment, where it begins to form an abscess, for example. And that abscess can only be drained surgically. You have to cut through the soft tissues, right? That's why we need to have a good knowledge of these spaces, because these spaces can be filled with infection, can be infected, and then the infection can conduct to different compartments. You can have abscess formation in compartments that are far away from where the infection initially began. And then you can also have weak spaces. You can have weak spaces within the neurovascular bundle, and so you can have an escape. You can have an escape. You can have an escape through a weakness in the facial capsule, right? Because you have a capsule or a sheath around the neurovascular bundle. That capsule of sheath can have a weakness, right? Can have a weakness, and then in that weakness, the pus begins to flow out. For example, in the parotid gland, right? So you can have an escape of the pus through a weakness in the facial capsule or facial sheath. Now, as we said, it's very important to know cellular spaces and their bioinflammatory processes. Why? As we have just discussed, this will allow us to make the correct surgical intervention at the right time. All right. So that's it, guys. Thank you so much for if you have stayed until this far. That is it. Well done. Thank you so much for watching this lecture through. Don't forget to like, share, and subscribe, and share this with your friends. Like, share, subscribe, and share it with your friends everywhere you know. And I hope this lecture was very helpful for you. I hope it helped to clear certain things that were ambiguous, right? Remember, the superficial fascia covers the entire body, proper fascia covers the entire body, and then the proper fascia divides into the superficial lamina and the deep lamina, and then the deep lamina and superficial fascia are connected by the septum, and then that septum divides now and forms, that division by the septum causes the formation of compartments. And then you can have the superficial lamina and the deep lamina surrounding a neurovascular bundle, or surrounding a group of muscle without a septum, or surrounding a muscle alone, and that is called a capsule or a sheath. And within that capsule, you have the intercellular tissue. You have the cellular tissue. You have a cellular space covered by cellular tissue. Infection can happen there, and that infection within the cellular space can travel from one compartment to another, or to a furthest compartment that can form abscesses. All right. Thank you, guys, for following through. We'll see you again in our next video, where we'll be discussing more exciting topics of topographic anatomy. Cheers. And peace be to you.